Thank you, Diane, and thank you for the invitation to give this presentation here today. I'm going to present parts of the report focusing on the prevalence assessment and diagnosis of dementia in minority ethnic groups. And as we already heard from Diane, there's an increasing prevalence of dementia in minority ethnic groups across Europe. And as Diane also said, that we expect actually a 7-fold increase in both the UK, and we have similar numbers in Denmark and probably also other European countries, although the data do not exist yet in many countries. And by saying there's an increasing number of people from minority ethnic groups with dementia, of course we also need to prepare our services for this not new group, but increasing group of people who are going to show up into both social and healthcare services. What we also know is that the main reason for this increase in the number of people with dementia in minority ethnic group is demographic aging in a relatively young population. As we heard, many people in minority ethnic groups will be migrants coming from other parts of the world. And we had large waves of migration, especially from the 1960s to 1980s in many European countries. And those are the people who are growing old now, and dementia is becoming a more prevalent issue. What we also know is that the prevalence of dementia might actually be higher in some minority ethnic groups. Several studies from especially the US have showed a higher prevalence in minorities in the US, but we also have studies from Europe, mainly from the Netherlands and the UK, which are high-quality studies showing a higher prevalence among some minority groups compared to the majority populations. Reasons for this might be that these groups are in increased risk of developing dementia, both due to a higher prevalence of medical conditions such as diabetes, vascular risk factors, and also depression in some groups, but also to non-medical risk factors. Mainly social isolation, but also a low socioeconomic status or low level of education, leading to lower cognitive reserve. There's still a lot of research needed to disentangle these effects in minority ethnic groups. But what we know is that there's an increasing number of people who are going to show up in our both diagnostic departments, but also in social and healthcare services. So another issue we looked at is the complexities of doing assessments across languages and cultures, and also educational levels or different educational systems. We know that the pathological processes and symptoms of dementia are more or less the same across cultures. So they should look the same or give the same presentation. But as we also know is that dementia is mainly a clinical diagnosis, so we need to talk to each other and need to look at behavior to understand what's going on. And this might be challenging across cultures and languages. What we know from research is that many of these issues concerning language, culture, and education pose barriers for both early and accurate assessment and diagnosis of dementia. If there are language difficulties, you might need to work with an interpreter, which poses many challenges, which we'll hear more about in the next presentation. Also, in most countries, there's not access to many well-validated cognitive tests or other rating scales that can be applied across languages and cultures and educational levels. As you can see, or maybe you can see, these are some often used copying tasks used in screening tests, and the performances you see on the right are actually from cognitively well-functioning people with limited education, and it might be completely impossible to discern between performances of a person with mild dementia or a person without education. It looks the same. Also, cultural perceptions of dementia and health, including normalization of memory problems in old age as a normal part of aging, and stigma and taboo concerning mental health, including dementia, might delay help seeking among some minority groups, or even result in not seeking help at all. And also in the literature we can read about prejudice from both parts, both from healthcare professionals but also from patients and families, which might affect the doctor-patient relationship and then again affects the diagnosis or the quality of the diagnosis. And finally, there might be some structural discrimination, as we see that many people from minority ethnic groups are not referred for specialist services by the GPs. So all in all, this may have several consequences for people from minority ethnic groups and their families. What we do know is that a lower proportion of people from minority ethnic groups actually receive a formal diagnosis of dementia, probably due to the barriers that I've just mentioned. And of course, as Diana already mentioned, without a diagnosis, you might not get access to dementia services, including social services and care services and support and so on. We also know that many people from minority ethnic groups are being diagnosed later in the stage of dementia. There's a delay in the diagnosis. And this might again be a result both of later help seeking, but also due to barriers at the level of the GP when seeking help. It's not being recognized as a dementia issue. And again, this might put extra strain on the families supporting and caring for the person with dementia, and also affect the person with dementia and the quality of life. We also know from research that due to many of the challenges of doing good quality assessments across languages and cultures, some minority groups end up getting a substandard dementia diagnostic workup. They're not getting the same assessments as people from the majority population, including structural brain scans and blood tests. It's being performed less with patients from minority ethnic groups for various reasons. And this affects the quality, of course, of the diagnostic workup, but might also result in misdiagnosis or giving a wrong diagnosis. This has potentially a serious impact on the well-being of the patient, both if you're giving a misdiagnosis of dementia and you're actually suffering from depression, you're not getting the right treatment or the right medication, or the other way around. If you're being perceived as having depression and you really have a dementia disorder, you're not getting the right treatment, including medical treatment and social care. So what we also looked at is some of the recent developments that have been in terms of developing culturally sensitive cognitive test instruments in Europe. There's a relatively large literature from the US, but the situation of minority ethnic groups in Europe is very different from the US. So we only looked at tests developed in the European context. And we identified 3 instruments. One of them is the Roland Universal Dementia Assessment Scale. That was originally developed in Australia, but has been validated in several European countries, including the Netherlands, and Denmark, Greece, Germany, Belgium, I think, and also Spain in a Spanish population. Another screening test is the cross-cultural dementia screening tool developed for minority ethnic groups in the Netherlands. And both of these instruments are screening tests that can be used at the GP level or in memory clinic settings. And then a more recent development is a neuropsychological test battery. It's a more thorough battery, taking more or less an hour to complete by a trained neuropsychologist, which is called the European Cross-Cultural Neuropsychological Test Battery. And it includes the Roland Universal Dementia Assessment Scale and several other tests covering different cognitive domains. So, based on our literature review, we have come up with many recommendations, but here are a few concerning diagnosis and assessment. So, knowing that risk factors for dementia are more prevalent in some minority ethnic groups, attention should be paid to the management of these risk factors, as they are potentially modifiable and they may actually prevent some dementia cases. Also, we believe that measures should be taken to improve timely and accurate diagnosis of dementia amongst minority ethnic groups. This could both focus on increasing awareness about dementia among minority ethnic groups, but also increase cross-cultural competences among healthcare professionals. Based on the literature research review, we also found that more research is needed to explore the challenges involved in diagnosis and issues related to the underdiagnosis among some minority ethnic groups, as well as the reasons for misdiagnosis and how this might impact on the families and patients. And finally, pending the results of further and ongoing research on developing cross-cultural cognitive measures, we believe at this stage the route should be considered for the assessment and diagnosis of dementia in people from minority ethnic groups, and perhaps in combination with other cognitive tests, including more well-established tests, or some of the measures that have been presented here today. And thank you.
Thank you very much, Rune. You have a few minutes left. Would you like some questions?
Please, if anyone has any questions.
Jane?
Hi, thank you. That was very interesting. I'm struck by the lack of diagnosis. What about educating the medical professions to be a bit more proactive? If they're giving people the wrong, not the wrong diagnosis, but if they're not giving people the tests that they give people from non-ethnic minorities, then they need educating equally as much, perhaps.
Definitely. Education goes both for the families and the people in the minority ethnic communities, but definitely also the cultural sensitivity of healthcare professionals. And I absolutely agree with you. If we want to identify the people with dementia among minority ethnic groups, we need to be much more proactive in identifying people at risk, because many families will not seek help until quite late in the disease course. And then we have to admit we do not have much to offer.
Any other questions? No? Oh, okay. That's the last question then for now.
Hi, thank you for your really interesting input. I'm wondering a little bit about, is it really that easy? I mean, not to say that you say it's easy, but when you say there's the call for early and differential diagnosis, that is, of course, what we generally say, we the professionals. But I mean, we are now, especially with culturally diverse minority groups, we actually, I think, are facing the question, is that always what they need, what they want? And do we create a